Okay. Colleagues, welcome to the Global Coalition to Address Synthetic Drug Threats. This is a special meeting for Working Group 3.1, Working Group 3 on Public Health. I have a few announcements and then we will get started. First, to thank and congratulate you all. We have now over 1,500 participants in our coalition. These are members representing 149 countries. We have had 70 hours of sub-working group meetings to date, and the goal of today's session is to discuss progress made over the past 6 months since the last working group meeting, to review draft recommendations as well, to invite comments before these recommendations are posted on the website. And I want to highlight, as I did last month, that governments do not need to adopt all recommendations, and they can also implement additional recommendations. Also, if additional discussion time is needed for some sub-working groups, we can continue these discussions of recommendations at the April session of our sub-working groups. Furthermore, the implementation of the initiatives will also begin in April, so please continue to visit the website and identify which initiatives may be of interest to you. And how to do that? Well, if you go to globalcoalition.us, you will see the initiatives menu, where you will see nearly now 120 initiatives posted. You can click on them individually, where you will see description, background, and other information. And at the very bottom, you will see contact information for who you can inform if you would like to participate in these individual global initiatives. In addition to these initiatives, we will also be inviting you to share with us your own domestic, your national actions that support the recommendations, and those will also be captured. So you could, of course, do the international initiatives, but if you would like to also just share your domestic, your national responses, that is also more than welcome. I'm going to stop sharing my screen now so we can get started. We have a lot to discuss today because we have 3 sub-working groups. So I'm going to first ask and see if our co-chairs are on. From the United States, Chris Jones was here earlier, but unfortunately he had to step out. So I'm going to turn it over to our Mexican colleagues to then serve as the chair for today's session. And then they will call on the sub-working group co-chairs. And we also have some cross-cutting recommendations that we can share before that as well. So over to our colleagues from Mexico. Thank you. Hugo. Buenos días. You're on mute.
And Hugo,
hola, ya me escuchan, ¿verdad?
You can hear me now, right? Yes, hello.
Hola.
Please go ahead.
Good morning, everyone. I'm Dr. Hugo Gonzalez from the National Commission for Mental Health and Addiction in Mexico. Today, I represent Dr. Manuel Quijada, whose schedule does not allow him to be with us today, and I also have Iris Marisol Teño, also from the National Mental Health Commission. And we would like to extend warm greetings to all of you here today at this March session, where we will put together and hear a few of the initial initiatives and proposals as a part of Working Group 3. I have been following all of these sessions, and I can tell you that they have been, or I have learned quite a bit from them. And it is a great way to hear about the experiences of other countries worldwide. I think our region, Latin America, we need to make the most of the experiences that countries such as the US have had in Europe as well. And this agenda for the coalition, these agendas have helped us understand where we are and where we're going. So, Brian, it's a true pleasure to be here with you to share in the coordination of this meeting. And with that, then I will hand it over to you, Brian, to continue then with our first presenter today. Thank you so much.
Thank you very much, Hugo. Pleasure to have you here, and thank you so much for all your support over all of these months as well. We're very much appreciative of the expertise and the support from Mexico. Thank you so much. So we have some recommendations that are cross-cutting that affect all of the sub-working groups. So I would like to ask my colleague Sarah Finmore to put those up on the screen and to read those to all of us. Please have it in your minds that this is for prevention, for the subworking group 3.2 on addressing people with substance use and substance use disorders, and then for the alternatives to incarceration, conviction and punishment working group as well. Did you want to read through these, Sarah?
Sure thing. I will read them through directly and so that we can have the interpreters translate them through and then we could discuss after. So first, 18, improve the quality of prevention, treatment, harm reduction, recovery, and justice, such as alternatives to incarceration, systems at both the national and local level, using training, mentoring, technical assistance, and sharing of best practices through professional networks and regional consultations. 19, upgrade the practices of the workforce professionals and other actors and/or volunteers through workforce development, networking, professional exchanges, training, technical assistance, mentoring, and certification to align with international standards. Number 20, consider protective factors, social determinants of health and equity in addressing substance use, including specialized approaches as necessary in providing support for marginalized populations to result in tailored policy and/or service approaches. 21, identify opportunities to mainstream the issue of synthetic drugs into relevant global and regional forums. 22, develop, expand, and disseminate substance use research to better inform policy and practice in consultation with a wide variety of stakeholders, including people with lived experience. Number 23, educate communities and the public as to the latest science on substance use disorder, prevention, treatment, and recovery, including accurate reporting in the media and promoting and using non-stigmatizing language. Over.
Thank you so much, Sarah. I think one thing I forgot to mention was the incredibly diverse and number of recommendations that we received for Working Group 3. Working Groups 1 and 2 combined had 17 recommendations. Working Group 3 has 33 recommendations. So it was quite a number of recommendations. And these we felt were cross-cutting and affected all of the sub-working groups. So we elevated them first. Now, to save time also, because we just have 1 hour of discussion. And again, if we don't finish, it's perfectly fine. We can continue in the April sessions. But I want to move into the next sub-working group discussions. And I'd want to introduce those 2 co-chairs so that they can give us their reflections and then present their recommendations. And then we can have a discussion on those recommendations. If we want to discuss these as well at that time, we can do so. So without further ado, I'd like to turn it over to Carolina Bruce from Chile and Ingadora Sigfúsdóttir from Iceland to lead us in 3.1, preventing drug use. Thank you.
Thank you, Brian.
Hola, muy buenas.
Carolina
Buenas tardes.
is
Gracias, Brian. Y,
on our behalf.
bueno, saludarles a todas y a todos.
My warmest greetings to all of you. We also, I will try to speak slowly because Chileans can speak a little fast. So we went over these recommendations for prevention. We first had several meetings with experts who were able to comment and present on different programs. And our overall recommendations have to do mainly with having the perspective, the focus on prevention that considers a holistic focus, a comprehensive way of working that allows us to work on prevention at different levels, environment, universal, selective, and targeted in different contexts, in families, in schools, in the workplace, in the community. These programs need to have synergy, a focus among them. We looked at models in place in Iceland. We also looked at the importance of including the media and social media in prevention systems. So we're not just focusing on people as users of programs, with us as experts coming in to say what they need to do. Rather, we want them to be included in the creation of their own prevention processes. And we do have experience of programs that are evidence-based and that we can make available as well. Another recommendation that we came up with in our sub-working group in prevention has to do with the fact that there needs to be close coordination between picking programs that are evidence-based and diagnoses that we might have. And here we looked at something that we looked at a couple of presentations ago, a couple of discussions ago. We looked at the relevance of generating data that is relevant locally when it comes to use patterns in general and synthetic drugs specifically. So there are several issues that are very specific to use patterns, types of substances, and the vulnerabilities that are there when it comes to this substance use, and these are absolutely necessary. They must be considered. We also discussed this, and we included it in our recommendations. We talked about being able to work together with legislative systems in countries. Talking about preventing substance use has to do with taking a comprehensive look at what is happening countrywide and looking at our realities and looking at the communities that we're working with. So we need to have a very strong, we need to be very well aware of regulations that exist, initiatives, laws, but also social norms. And then we need to adjust our diagnoses accordingly. And this is something that we recommended as well. We recommended working with young people as a group and young people as agents of change as well. So boys, girls, young people, they are agents of change when it comes to prevention. And we need to work to propose strategies that are proven, that are evidence-based, but also those that will allow us to transfer these capabilities that will help us deepen communities' abilities to create their own prevention processes. And finally, we also recommended training and a constant updating of training of people who are participating in the process when it comes to facilitating and implementing prevention programs. Prevention professionals, those of us who work in this area, must constantly train ourselves. We must be up to date so that we can then do the work we need to do in order to support communities, to support them, and also get to work in communities, teach them so that prevention policies are sustainable over time. Oh, my last recommendation, sorry. This has to do with mainstreaming that we need to take into consideration when it comes to stigma. We cannot talk about prevention if we don't promote a stigma reduction in our own interventions. It's not a matter of having a specific stigma prevention program per se, but we need to include this perspective, gender rights. We need to include acknowledgement of human dignity in every session, every program that we have. I'm not sure if I left anything out. You can find these in the presentation that you received via email. So each one of these items is there. And if possible, then I'd like to open it up to discussion so that we can discuss the recommendations that we made. Thank you.
Thank you. And I will say just before we start that I'm going to pause the recording so we will not record the discussions. Thank you.
Camila has asked for the floor. Camila, go ahead.
Hola a todos. Yo solamente
Hi,
incluí
everyone. I would just include something that we talked about constantly in the group. We talked about the importance of monitoring and evaluation programs when it comes to implementing programs and prevention strategies, as well as sharing best practices among countries and communities. That was another of the considerations that we kept in mind when we made our recommendations.
Thanks, Camila. This is very important to mention. Mariano, would you like to go ahead?
Sí, muchas gracias. Muchas gracias.
Yes, thank you very much. I think, Carolina, you provided a very good summary because you covered all of the points on the list, but the overall picture is very well drawn. Because I think that we need to have a comprehensive narrative as far as prevention. So there was something that you may have said, but I don't know if it was entirely clear to me. Something that we were discussing a lot as far as prevention that also touches on recovery and treatment is the central role that the geographic setting of interventions plays. So we're discussing paradigms, prevention programs that are evidence-based, that seek to not stigmatize participants. But when we want things to truly change in society, we have to really ground that in the specific place where it is being implemented. And so everybody who lives there with all of their cultural, social, policy dimensions should be able to implement a system of prevention that is truly based on that area's reality to change circumstances there. And so an important point is that we have to really ground our work in certain places, in communities, in specific cities. And specifically for their inhabitants. And point number 3 specifically talks about justice-involved populations as alternatives to incarceration, specifically treatment. Geographic context is also very important for integrating justice-involved, drug-involved people in these efforts at a local level so that they can truly recover. And so I think that geographic context is a topic that I come back to a lot, but that will make our efforts effective and it will give us a very clearly defined focus for acting. Thank you. Thank you, Mariano.
Mariano, Caro, if I can add to this, what Mariano was saying, I think this is really, really important. That, but we need to keep in mind that the gathering of data when we do studies that are we're going to base our policy on, the studies need to be comparative because we are all the same around the world, but the implementation of the work needs to be, probably this is exactly what Mariano was meaning, the implementation of the work, of the prevention work needs to be tailor-made for each community. I hope, Mariano, that I'm explaining or understanding you right. Don't hear from Mariano, so Tonini.
Ok, hay dos palabras más. No, está bien.
That's great. Sounds good. Thank you.
Thank you, Ingadora. Yeah, I'm Rachele Donini. So yes, I read the statements for Working Group 3. And I just wanted to discuss the specific ones of my interest, which is Group 3.1, Preventing Drug Use. So there are two things here that I would like to discuss with all of you. The first one, where it says analyze national drug prevention systems and align them with the UNODC international standards on drug use prevention. Well, I agree with this. Of course, UNODC are international standards, but for example, here in Europe, we are working a lot with the UPC, the European Prevention Curriculum, and it is part of this curriculum also the European quality standards. So what we teach and how we train professionals is mainly on the international standards and the European quality standards. So I was wondering here if we couldn't put something like analyze national drug prevention systems and align them with the UNODC international standards and the specific standards that are appropriate for each country, because of course we need to in some way also keep into account the adaptation and the specific environment of each country. So something here that shows and says that each country should rely also, if they have national quality standards or national standards on drug use prevention, to rely also on that. Otherwise, it sounds a bit too, let's say, USA centered. I don't know if it's clear what I want to discuss here, but I would in some way put also the specific national quality standards that are available in each country. And the other point is incorporate youth to harness their potential and influence as agents of evidence-based prevention responses, and not only as recipients of it. So I agree with this, and I think it is really important. I was wondering the phrasing of this statement, because if we consider youth, it is difficult to think at youth as an agent of evidence-based prevention unless we have already in some way trained youth in evidence-based prevention. If I think in Italy, there are many professionals, people of the workforce that implement interventions that are not evidence-based. And we are saying with this global coalition that we need evidence-based interventions, and I totally agree. But what I'm trying to discuss here is that we can't ask youth to be agents of evidence-based prevention. I understand what we want to state here, which is really to involve youth in the implementation and also the designing of prevention interventions. But if we put agents of evidence-based prevention, it looks a little bit too much professionalized for a youth, for a young person to be to have all this competence. So maybe we can just put as agents of prevention responses, and or maybe add that also we can train them as agents of evidence-based intervention. I don't know if it's clear what I would like to discuss here. Thank you.
Muchas gracias. Sí, queda claro.
Thank you very much. Yes, that's clear. I think I don't think the purpose of this was considering that everybody who implements an evidence-based program necessarily needs training for that. I think that this spirit of that lies more in the need to recognize the transformative capacity of young people and the absolute necessity of working not in an adult-centric framework, but to strengthen young people's abilities as change agents. And it doesn't have to be an evidence-based program, or at least with respect to this particular recommendation, we want to be able to recognize young people as participants in their own prevention efforts. But that could be drafted better, perhaps, so that it is clearer. And I'm looking at you, Brian, with respect to that. If it is not clear as currently drafted, we could even make changes. And again, stress the training necessary for carrying out prevention efforts, because the experience of some countries in Latin America has shown that anything counts as prevention. We need to offer rigorous training to people who work in the area of prevention, but we also want to recognize young people as change agents in their own lives, rather than focusing on us. And then we also want to offer technical assistance, because we don't want to leave them to their own devices in the process. We want to offer technical assistance to young people so that they can truly bring about transformation. We were going to hear from Hugo. And I'm not clear whether Brian or Miriam had raised their hand first. Hi, I think my microphone is unmuted, and I appreciate the chance to weigh in. Looking at all of these recommendations, I'm reminded of a UN slogan launched last year in the context of the International Day against drug abuse and drug trafficking, and that was putting people first. So I think this is a phrase that cuts across everything that we've been seeing in these recommendations, particularly pertaining to this group. And I wanted to also point out that in Mexico, in Mental Health and Drug Abuse Commission, we're working on a national addiction prevention strategy that will soon be published on our website. This is the fruit of a years-long effort by this current administration, and also incorporates young people and other entities in this work. For example, there is a tight partnership with the Mexican Institute for Young People and for Sport, so that interventions can be carried out that are not strictly focused on preventing drug abuse, but also seek to improve conditions throughout the country. And so, to wrap up and to not go too long in this comment, just now, as we were discussing young people as active participant in these efforts, we have an initiative in Mexico that we'd like to share on the coalition website that is referred to as Youth Contact, which is a network that's been created nationally that consists of young people who have been trained to educate other young people on drug abuse and mental health, and perhaps refer them to places where they could get additional support through, for example, a chat on WhatsApp. So Latin America does have initiatives to share, and these are efforts that we could share on the coalition website. So thank you very much for allowing me to speak about this. Thank you for participating. And so I believe Miriam was next, and then Beth. Medium, we can't hear you, or that might just be me.
Miriam, we cannot hear you. Can you please speak closer to the microphone, Miriam? Thank you.
Yes.
Buenos días, ¿me escuchan, por favor?
Good morning. Can you hear me?
Yes, please go ahead.
Sí, bueno, desde la Secretaría del Comité
And
Interinstitucional.
so, on behalf of the Secretariat for the Interagency Drugs Office in Ecuador, I'm very thrilled with the coalition's work and their prevention efforts. And so I wanted to share our experience at a local level in different agencies. Specifically, we have a project that is called Youth in Action, and we're really working at a community and family level to strengthen these young people's abilities and create interinstitutional capacity among different sectors. And I agree with what Camila and Mariano were saying. If we don't ground our policies at a local level, at the grassroots, we're not going to move forward toward our goals. And we should be working within the framework of international frameworks. Here in Ecuador, we have our constitution that has a strong human rights focus that talks about working with groups that need particular attention. And this is a part of our organic law, and that is engaging and empowering all people, not only young people, but also we work with children and teenagers educationally to be able to work within a psychosocial framework in a community context in a cross-cutting way across community educational and family interventions. Also, we think that it's important to work in the creation of a series of networks and empowering all people. That's why, as you mentioned, it's so important to have education and training for people who are really on the front lines of these efforts so that they can offer this sort of assistance. And another point, to piggyback on a point that Mariano mentioned that I think was very important with respect to prevention, treatment, and rehabilitation, specifically with respect to therapeutic interventions, it's important to consider what strategies we can implement to support people who need assistance without stigma throughout their lives, which is oftentimes very difficult in our countries. Thank you very much, Miriam.
Yes, thank you very much. I just wanted to respond to some of the comments that have been made. First, to Raquel's point, absolutely. Thank you for that formulation of the language. We are taking notes, even though we are not recording this part of the session. So we will be sure to amend those to first on the international standards to include and specific standards that are appropriate for each country. And then second, for youth to formulate, as you mentioned, as agents of prevention responses in terms of, instead of delivering evidence-based from the youth themselves delivering evidence-based. With regard to Hugo's point, absolutely, we're looking forward also for all of you to share on the website. We have, it's taken us some time to get that feature up, the interactive feature, but we are looking at a beta test at the moment, and hopefully that will be then available for all of you to start sharing contributions directly onto the website. And I will also say that we are past time. As you'll notice, we've got about 22 minutes left, but no worries, because whatever we don't complete today, we will continue in our sub-working group sessions. I am hoping, though, that we can get to 3.2 because there's a lot to discuss and a very exciting amount to discuss there. And we could, of course, continue 3.2's discussion at the April session and 3.3 as well, as it looks like we're running out of time. But I'll turn it back to the hosts. Thank you.
Thank you so much, Brian, for filling in all the missing points that we needed. Are there more people that want to comment or suggest or ask questions? If not, then maybe we can move on. What do you say, Brian?
Okay. Well, thank you so much to both of our co-chairs in that very rich discussion and update. I'd now like to turn it over for subworking group 3.2, engaging people with substance use and substance use disorders. Dr. Nicholas Priest and Dr. Yuri Kutipe, over to you both. Thank you.
Yuri o Nicolás, ¿no?
Yes, I don't know. Is
Yuri or
Yuri on?
Nicholas, right?
Otherwise,
Nicolás.
Nicholas then.
Bonjour. Bonjour Brian, bonjour à tous.
Good morning, Brian. Good morning, all. We look at how we can accompany those who have problems with using drugs. And maybe we can go to the slides. That gives you a sense of what we've been discussing in our subgroup. It'll give you a sense of how we've worked up until now. Thank you, Sarah. Very well. We have the 5 sessions that have occurred between November and February with presentations that were made, for the most part, international organizations that made it possible for us to cover the various themes you see on the screen that have inspired the recommendations that Yuri will be going through in a minute. I just want to summarize our work by saying that we focused on critical moments in the life of those who use drugs, critical moments because of dependency and critical because of potential problems with overdoses, and critical also because there is always an issue related to contamination when you use drugs. And there's also a problem with people who are coming out of society when they're using drugs. And we're looking at populations that are facing difficulties based on their social position, based on their gender and age, with interventions by presentations by international organizations that have focused on all of these themes. And all of these presentations have been quality presentations. We want to focus on quality, no matter what you're doing when it comes to reducing risk, when it comes to recovery. Many people have been inspired and are working at the community level. And there's always an issue of improving the quality. Oftentimes it requires mobilizing resources, and that's what leads to good interventions. So we are focused on quality and efficiency and the coordination of the parties. And we're focusing on fragile audiences, groups that are most vulnerable at various times in their lives when risks are more important.
J'ajoute peut-être un dernier mot, pardon Brian.
Just wanted to ask or add one thing before I give you the floor to present the recommendations and to open the floor. We've identified a number of points that require our collective action. We need to work together with the governments, with the various parties for research, for fundamental research that can lead to better treatment and a better management of these issues. That's it. I just wanted to add this quickly.
Excellent. Do we have Yuri on the line? I thought I saw him earlier. I do see he's on, but perhaps he's having difficulty unmuting. So I'm happy to read the recommendations Sarah, if as we wait for Yuri to update his audio, I can read the recommendations and we can then have a discussion. So we have recommendation 34, expand naloxone availability and access, including training for active drug users, first responders, and other groups that are likely to encounter an overdose to prevent overdose deaths and promote post-overdose intervention programs where appropriate and in accordance with national legislation and regulations, and develop data reporting systems regarding naloxone provision both within the public health system and by first responders to further evaluate the impact of the availability. Anywhere we see red text or marked out text, it's because when we sent out the last, after we sent out the last edits, we had, or the last version of the document, we had further edits that came in over the weekend, so we made additional edits. 35 is to develop and implement scalable interventions for the treatment and care of stimulant use, concomitant use, and other emerging drug use disorders, including contingency management. 36 is to expand access and improve coordination between prevention, early intervention, treatment, care, recovery, rehabilitation, and social integration services, particularly for marginalized communities or vulnerable populations. Any others? 30, well, it should be 37, I think, with the numbering based on the last one, but let's say 36 here. Promote evidence-based treatments for substance use disorders, including adopting national quality assurance systems of care based on the UNODC WHO international standards for the treatment of drug use disorders. 37, to build recovery capital through the establishment of local and regional recovery networks, organizations, and workforce. 38, develop and implement gender-responsive and women-specific prevention where appropriate treatment and recovery services, and concurrently expand and improve the quality of the workforce providing these services. 39, develop strategies to reduce stigma and increase understanding of stigma as one of the largest barriers to care. 40, develop strategies to improve access and uptake of medications for substance use disorders, specifically medications for the treatment of opioid use disorder. 41, promote a national treatment rehabilitation system and national recovery system with support for local implementation involving local political authorities, local government agencies, education, health, social affairs, culture, sports, public security, among others, the community, and local social organizations. 42, create and promote a system for continuity of care for individuals with substance use disorders, including identifying and strengthening each level of care and addressing local needs. 43, implement systems or mechanisms for recording information to monitor and evaluate treatment services. 44, promote social integration to foster the consolidation of effective treatment and rehabilitation, to contribute to prevention and the reduction of stigma, and provide greater sustainability to change. Then we have some new ones that have come in. Differentiate consumption patterns according to their intensity and associated risks for the individual and for society, and focus our action on the most risky patterns of substance use. Is that all, Sarah? Oh, we have more.
Oh, no, these are for 3.3. That's all for 3.3.
That is it for this one. Okay. So with that, I will turn it back to our co-chairs for discussion. I will say that I'm going to pause the recording now, so we are free to have more of a discussion, and we will continue the discussions. And if we do not finish today, once again, we can continue these discussions in April. Back to Nicholas. Thank you.
Thank you, Brian. Maybe we'll now turn to anyone with a comment or a question based on the recommendations or the themes that we covered in our conversations. Mariano, you have the floor.
Gracias, Nicolás. Solo mi preocupación con la última
Thank you,
recomendación
Nicholas. I just have a concern about the final recommendation that's in red. I believe that it is very important to first identify and rehabilitate problematic users, that is to say, drug abusers or people that have a diagnosis of problematic drug use. I would like to resort to the international classification of diseases because that is the focus, to rehabilitate problematic users, the ones that are dependent and that need help. If we're only going to treat people with high intensity of use, where are we going to draw the line? And I do not believe this is a good public health action. In public health, you need to anticipate your actions and you need to rehabilitate people that are showing signs of trouble, but not only the ones that are in deep trouble. So I believe it is important to once again focus on the international classification of diseases and identify that group as the one that needs to be treated and rehabilitated. So that is the only concern that I have. I agree with everything else in the presentation. Thank you.
Thank you, Mariano. That is very important to clarify this point. I understand your concern indeed. The concern behind this recommendation when it comes to risking leaving behind those who do not have serious disorders, but whose disorder could get worse. I agree with you on your analysis and referring to the national classification of diseases. What I suggest is that we look at refining this point to make sure that we focus on the right priorities, all the while making sure we don't leave behind a part of the population that requires our attention. Thank you very much for this very important point, Mariano. Jose Luis, you have the floor from CICAD.
Thank you very much. Since Yuri seems to be having a hard time turning on the mic, we exchanged some WhatsApp messages where he told me that he had some additional recommendations. I'm going to focus on the one that we discussed the most, and he would like to add to identify barriers to care for the population with drug use problems with an emphasis on synthetic drug use. So in English, it should say, identify the gaps in providing and I am sure that he will be sending both versions in English and Spanish via email. And once again, thank you for giving us the possibility of working in these sub-working groups.
Merci beaucoup. On sera très preneur de la rédaction précise de Yuri.
Thank you very much. We'll await this from Yuri. Ahmad from Pakistan, you have the floor.
Thank you so much. Although this is very comprehensive and it's, workable, all the recommendation. To some extent, in some country it's easy. To some country, it's difficult. We should underboard the law enforcement agencies. Whether we are doing any prevention and treatment program in some of the area, it's difficult to implement there. Therefore, we also on board the law enforcement agency, not only the support, also we train them, we train some of the law enforcement agency. In some countries, if I talk to you, in my countries, in the district of Chatra, mostly, there the pupils are, the seller and buyers, some other countries, they're coming. Therefore, we also giving the awareness and, these all the things, This is not if human resources develop, countries to develop. Therefore, we should on the board law enforcement agency. It's very important. Although it's mentioned their education, all the things this is important. For some other countries, it's law enforcement bring on the board is very important. You know, especially in developing countries. Thank you so much.
Merci beaucoup, Ahmad. C'est très
Thank
important.
you, Ahmad. What you just mentioned is very important. That's always a risk that we run with global initiatives, is that we are not on the level of playing field. We don't have the same situation to start with. Everyone has weaknesses and strengths. But I think Brian said as an introduction, the idea with these recommendations is for each and every one to take what is most fitting for its own capacities. And there are international mechanisms that help with solidarity, but we shouldn't be prevented from targeting higher than we can to see what works at each of the scales. And we can experiment on smaller scales in environments like yours. Thank you very much for this comment. It was very useful. Mariano, you have the floor.
Nicolas, I would like to reinforce what Abrat said, because I believe one of the things that we have not done in demand reduction is to engage the police and law enforcement agencies for them to know what drug demand is all about, because law enforcement agencies specialize in persecuting crimes and focusing on the supply side. But oftentimes, they are the first responders, the ones that come face to face to with drug users on the streets, and they have no idea maybe that drug use is a public health issue that can be treated and that you can recover from. So I believe that one of the recommendations is missing that speaks to what Aram was saying, and that is to engage law enforcement agencies so that they understand the phenomenon of use, so that they do not do more harm than good. Because if they're not informed and well versed in consumption on use patterns, they could cause a lot of harm among the patients that are drug users, and they may be treated as criminals of regular crimes, and that is extremely harmful. So I believe there's a lot that still needs to be done, and one of the recommendations should be to train law enforcement officers in demand reduction, not for them to engage in a recovery, but just so that they can have a better understanding of what this issue is all about. So I believe that we need to push for a recommendation to that effect. Thank you.
Merci beaucoup, Mariano. Je prends le point tout à fait clairement.
Thank you, Mariano. Duly noted. It is very interesting how you reformulated this. And in Europe, there are initiatives where we have law enforcement agencies participating in prevention, and also when law enforcement is called to an overdose site, it's a very important issue, and we have a number of things happening in France. Ahmad, you wanted to take the floor again. Go ahead.
Yes, sorry for this. One of the importance, with for the recommendation purpose at the large level, we can, also get the faith-based organization, especially the religious leaders, to some extent. Mostly in more rural area, the pupils don't know even its health issues. So for that purpose, if we can, engage the faith-based organization, especially the religious leaders, for the, macro awareness. So even the community we should be aware this is the health issues. There have, it's manageable. We treat them like if someone is, have health issue, we can community support them. Other people support them. If we see such a substance use disorder in the rural area, pupils say in, nickname, other names. So for that purpose, we should also include them this way. So thank you so much.
Thank you, Ahmad. During the previous session, we had a presentation on religious organizations working with the local community on drug use. So we are understand this issue. We were given a very good illustration of this issue. I know, Brian, time is flying by. We have nothing else. Nobody else asked for the floor. I just want to change the wording in one of the recommendations. We removed risk reduction, but I think we need to strike the right balance on this very topic so that we can have something that conveys the need to act. It is not the only useful way to act for those who use drugs, but there are interventions that have saved lots of lives since the HIV AIDS epidemic. Brian, I'll give you the floor maybe to conclude if there are no other, no one else wants the floor? No.
Sure. Thank you so much, very much, Nicholas, for stepping in. And sorry, Yuri, that we weren't able to get your microphone, but hopefully at the next session, I think we're going to leave these recommendations open for 3.2, and we didn't get to 3.3, so we'll continue those in our April meetings before saying that we have finalized them. I think it is very important to have that discussion, as you were mentioning, you know, terminology and how we sort of best characterize that to make sure that we are all encompassing in terms of the people that we are trying to reach and engage. And so we want to do that in the most appropriate and respectful way. So we'll continue this discussion in April's session. I have taken notes of all of the discussions and all the points that were made. So we will work to incorporate those. And in any case, we also look forward to the formulation of an additional recommendation that Yuri wanted to share with us. So we'll also read that on the screen at the April session and then finalize those so that we can post them in their final form on our coalition website, and then look forward to what will come after that, which will be the implementation of the initiatives. So apologies again, we knew that this was very ambitious to do in an hour. We got through 1.5 sub-working groups, but that was also expected. So very much thank you all for your time and commitment to the Global Coalition, and looking forward to continue this discussion at the next session. Thank you so much. Hugo, tienes la última palabra. You have the last word as our co-chair for today, the working group.
Gracias, Brian.
Thank you, Brian. This has been a very enriching session for all of us who participated. I think that there's a lot of work to do yet, but we have made significant progress in this process of making recommendations. I would like to thank Brian and everyone else who's here. Thank you from Mexico. I extend the greetings of our director, Dr. Quijada, and we'll see you at our next session in April. Thank you, Brian.
Thank you. Thank you so much. Thank you all so much. Take care, everybody.